All right. Dr. T, there's a treatment out there about, losing inches, in different body parts, which is called Zerona. Never heard of it, but tell us what it is.
We are very excited to be offering this in our office. Zerona
you offering
is...
it?
Yes.
Oh, okay.
Zerona is a device that, believe it or not, will actually help people lose inches. Hips, waist, thighs, no surgery, no cutting, no incisions,
what about
no
stomach?
injections.
What about belly?
Stomach, yes.
Belly.
That's abdomen. I call that abdomen. We can call it. Let's call it belly. Sure. It will help people lose inches. No incisions, no cutting, no swelling, no surgery whatsoever. It is totally painless.
Okay. How do you do it?
The actual treatment involves 6 treatments where a person will literally lay on a table for 20 minutes, turn around and lay on their backside for 20 minutes, and that's one treatment. They do that 3 times a week for 2 weeks.
In your office?
Yes. Now, there's a little preparation, not complicated. For the first week, you need to drink plenty of fluids, avoid alcohol. We want you to exercise. And I'm not talking about going to the gym for 2 hours. I'm talking about 20, 30 minutes of walking and drink plenty of fluids. That's
which a person should
1.
do anyway. But we should be drinking plenty of fluid. I think not drinking plenty of fluid is the cause of many, many problems we're having, and we're going to and eat pills because of it, when actually a couple bottles of water would probably do the trick. But that's a whole different topic. But so come on, laying on a table. I mean, I can lay on my table at home. There must be something. Come on, what does it do? Does it vibrate you? What does it do?
This is a laser. It's called a cold light laser. What that means is you do not feel pain. You don't feel heat. In fact, you feel absolutely nothing. But what the exciting thing happens on a microscopic level. The fat cells are made to literally release the fat. That fat goes into the interstitial fluid, the body compartment. You're taking a supplement, which is basically like a multivitamin, and that will help your body excrete the fat. People are losing 3, 4, 5, 6 inches and more cumulatively between the waist, hips, and thighs.
Cumulative. So basically,
so what I'm saying is,
if my waist is 44 now, it will then be 6 inch less, or be an inch going in the thighs, an inch there, so it's basically 41 or so, and maybe it goes down an inch or so.
Right, depending on the person, depending on a lot of different factors, you will lose. We guarantee at least a 3-inch loss, but most people lose double that or more total. So you may lose 2 inches off your waist, 2 inches off your hips, and 2 inches off your thighs, for example, or more so on the waist, depending on your body shape. There are people who are more apple shaped, more pear shaped, and we gear the lasers. We focus more on the areas depending on the person's body shape.
So you can't focus it. A person comes in who has, his fat accumulates in the thighs, and as I heard a lady saying, I have a second butt. So you can concentrate it there. On the other hand, with me, like with many men, it seems to be accumulating right after over the belt belly. You know what I mean? And once you can't see the belt anymore because the whole thing hangs over, you start looking ugly. And so you can concentrate it a little bit more there. And for some of us, literally 2 inches of that belly, frankly, would make a big difference, actually.
Yes. Now, I should mention that we are talking about the fat between the skin and the muscle. The typical, and this is typical for a woman who tends to have that soft, resistant fat that's there, almost like a fluffy kind of fat. Now, on the other extreme, we have men that have a typical beer belly. If a man examines himself and there has very little fat on the outside, but has a great big beer belly, that's basically fat inside the belly. This will not work in that situation any more than liposuction would not work in that situation either.
I see. Okay. So, I don't drink beer, so maybe it's just, it's just the sausages I eat in the evening and then go to sleep. All right.
Again, the key is that there is no incisions, no cuts, no swelling, no bruising, no kind of recovery, unlike any other surgical procedure. This is not surgery, and yet we are getting circumferential reduction. We're getting improvement in body shape. It's really an exciting, and the only FDA-approved device to be able to do that.
And is that something only Tom Cruise, Julia Roberts, and Brad Pitt can afford, or is that something the normal guy can afford?
It is very reasonably priced. The normal regular price is $24.95 for the 6 treatments, and we're having a current promotion up until our open house coming up in January of $14.95.
I see. Okay. Well, wonderful. I guess it's worth checking. If a person doesn't qualify for it because of, let's just say, it's a beer belly versus, a fat, you would, on your examination, notice that and would be able to say, look, it's not going to work for you.
Oh, yes. Like any other procedure we do, we offer, certainly for a limited time, complimentary consultation, no obligation. I will not offer any service that I don't feel has a reasonable chance or a very good chance of success in any particular individual.
Mm-hmm. Wonderful. And it works on the arms, it works on, wherever you have such an excess fat kind of.
Yeah, yes, and although it's been particularly FDA approved for the abdomen, the abdomen, hips, and thighs, that's our main focus, because that's the main focus of most people, where they have kind of resistant fat there that they want to lessen, they want to really improve.
Right. Great. Okay. Let us know more about it, how it's going to go, and give us some success story of people who do it.
We actually have people signed up before we actually received our equipment. We are now ready to go and fully operational.
Great. Okay, well, with no doubt, as we actually, for all purposes, live longer and we become, overall, I think a little bit more vain. Whether that's good or bad is beside the point. That's what it is. And I don't think, for a long time I was actually thinking that all this plastic surgery, and on top of it, you're not really doing plastic surgery, you're not cutting anybody, but all these improvements are kind of, a fake. But then one morning I woke up, and I don't know whether it was one morning I woke up, but it's a matter of saying, I go, I used to have a brown tooth here, and I had it for about 6-7 months before I got my butt into the chair of a dentist, and the difference was, of course, huge. And you wouldn't run around with ugly brown teeth, whichever way you got them, whether you were negligent on them or whether you got knocked out and it became that way in an accident or whatever. It doesn't really matter. And we're wearing shirts and ties, and we do all kinds of things to look good. We go to the hairdresser. What's so wrong with tightening your skin, making it, it's probably even healthy. If you said you take the excess skin out with microdermabrasion and stuff like that. Well, that's kind of like scrapping dirt out of. That's why we wash our face in the first place. So I changed my mind on that a few years ago. Of people who undergo those procedures. That's just normal body maintenance, and has nothing to do with cheating or with whatever, or it's just common sense to do. Now again, there's maybe a difference, maybe getting lots of surgeries, like maybe Mr. Michael Jackson did. Well, maybe that's a little bit on, off the deep end, and maybe not. But those stuff you're talking about, it just looks like we would, as I said, we would get cosmetic dentistry any day of the day, any time of the day, if it's needed, and nobody would say you are funny, you are vain, you are like whatever, right?
It's all about, feeling good about yourself. And when you look better, you often feel better.
Absolutely.
And I don't see any, and certainly no danger. I think that the problem can happen when someone puts their total value of themselves and their appearance. Then it becomes almost like a losing battle. But when you have a healthy self-esteem and you want to help this or help that, improve this, improve that, that's a very healthy approach. And certainly, again, improving your appearance, whether it's a little or more, feeling better about yourself is what it's all about.
Right. Well, obviously, anything we undergo in a compulsive way, and maybe that was Mr. Jackson's problem. There's a compulsiveness. Anything you do compulsive, no matter how good it is, will end up hurting you. But as you said, self-esteem. We in Austria, we used to have this saying, we still do, I'm sure, Kleider machen Leute, basically means clothes make people. Obviously, when we have a new suit and dress good, we feel better. We walk a couple inch taller. New technology makes it that we can go a little deeper. There was nothing you could do in the old days about faces. In fact, people had dentures and their face started caving in because their jawbones start shrinking because they have no more teeth in it. And there's nothing you could do. Today you put implants in it and you look right away a lot younger. So what's the big deal about the other thing? As I said, I love it, and I love to talk about those ways on how to make us feel younger, better. And by doing so, I think whether it's magically or whatever it is, we become more energetic and more lifeful and more happy. Thanks a lot, Dr. T.
My pleasure.